Now we're going to show what we've never shown before, and it's the targeted injection. And I think it's fair to say that it's not comfortable, but it looks a lot worse than it actually is. So I think a lot of people are like asking about these shots. They want to hear about them. It doesn't actually really hurt. I'm going to do it myself now. I'll make a terrible face when they do it to me, but it's just unusual to allow someone to put a needle into the back of your neck, the side or the front.
Done. And you can see that it is less than needle size inside.
And as for you, we can test of your obstructive sleep apnea. You have 19 apnea
Episodes
from 10 to 32 seconds for one night.
So I stopped breathing.
Yeah, you stop breathing. Absolutely.
I also think it was great that I was able to come with Benny. We had, he was breathing through his mouth, but now he's breathing freely through his nose. I'm a huge baby when it comes to shots. I'm not going to say much because I have a needle directly into the front of my throat. So we've arrived in Perm, Russia, and I'm here. My name's Andy. I'm American. I've been living in Russia for more than 20 years, and I'm here with my son. What's your name?
Benjamin.
Young man.
Benjamin.
And how old are you?
12.
And I'm not going to tell you yet why we've come here, but I'm just hoping that in a few days I'll be sleeping a lot better. More on that later. And Benny, how was your flight?
Fun, because I gotta watch Spider-Man.
Yeah. So just the city of Perm is just one Spider-Man away from Moscow. We'll tell you more about what we're doing here later.
This is your welcome pack.
Welcome back. This is like we're superheroes. We have a special phone for getting around Perm with our special task. And then this is our instructions, I guess. We are glad to welcome you to Lymphatech Clinic. Check that out, Ben. So, this is, by the way, this is our assistant, Grigory. But Grigory is a difficult word for me to say, so we'll just call him Greg. So Greg is going to help us around. He's going to tell us what we're going to do. What are we doing tomorrow, Greg?
A lot of stuff. It will be a busy day for you.
Yeah.
You will wake up pretty much early, and I'll take you back home at about 11 p.m. So you'll be crying.
So it's not vacation.
No,
Okay.
Not at all.
Not vacation, Ben. Lots to do tomorrow. We got this. Yeah, so I'm going to tell you, we've come here for some medical treatment, and Benny told me this is the place where we're going to stay. Is it going to be big enough where you won't hear me at night when I'm snoring?
Hopefully. If I hear you, then I'll be watching YouTube videos all
Hey,
night.
no. So there's a lot of nice hotels in Perm, but since we're going to be here for 10 days, we decided to get like an Airbnb instead of staying in a hotel. So let's go and check out where we're going to be.
Yeah, let's go. Hello, come on in. So when we came to Perm, we decided instead of getting a hotel, we're going to get a tiny apartment. So what we decided to do is we got this tiny apartment. It's just one room and then a bathroom right there. This is where I'm going to be sleeping. My dad's going to be sleeping there. This is our kitchen spot right here, where we just make food, wash dishes, and all that stuff.
Breakfast in here probably.
Yeah. That's where I'm going to do my homework and where we're going to eat.
And what do you want us to eat?
Pelmeni.
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 Some rest, and then...
Well, I first got to finish my homework.
Yeah, first you have to do your homework, that's right. And then we're going to get some sleep, and then tomorrow we have a lot of testing to do.
A lot.
Medical testing. Mainly for me.
Yeah, mainly for you.
Right. All right, so we had our first night in the apartment. How was this sleeping, Benny?
I woke up later than usual because of time zones.
Yeah, just a 2-hour time difference from Moscow. Yeah. But today we have probably the busiest day of our time in Perm. And I don't know if I can read all this. So can you tell me what we're going to do today?
So at 8:50 we're going to be picked up from the apartment.
I think that happened.
Yeah. 9:15 a.m. we're going to have lab tests, scrapes from throat and nose for bacterial inoculation.
I'm glad you're reading this and not me.
We can't brush our teeth. We couldn't eat or drink anything this morning.
Yeah.
We're also going to have CAT scans, x-rays, an MRI. We're going to have a physical exam. We're going to have treatment. And then we're going to have spirography.
I don't even know what spirography.
ECG, Holter
right.
monitoring of electrocardiography, ECG and blood pressure, BP. What is that?
Yeah, so that's like what they tell you to do at Lymphatech if you make the mistake of telling them that you snore. How to treat this? What needs to be done?
We have to know the reason of the snoring. And as I talking, the most common reason is inflammation of the bacterial and viruses infection. As for you, the same infections, you have bacterial, a lot of different bacterial infections, because we tested your nasal cavity, your throat, and now we can see the bacterial infections, and you have the viruses infection too. And if we treat the infections by our technologies, access technologies, we stop the development of infections. And if you treat your immune system, we stop the viruses development in your organism, and inflammation and swelling in your nasal cavity and your throat stop, and you can stop snoring.
So I was just with a cardiologist, and they did something that's never been done to me before, something I did not expect. You can see here these wires. That's only the beginning of what's here. I guess I have to show it to you. And so I'm going to be wearing this for 24 hours. And I knew what was going to happen, so I shaved my own chest last night. Because I wanted to do that by myself. So it'll say what's going on with my heart, I think oxygen levels, how I'm sleeping, and this is all very important information that they're going to take later and tell me all about. So I'm looking forward to a great night's sleep carrying this thing around. And apparently every 15 minutes it's going to check I have a blood pressure cuff on. Every 15 minutes it's going to check, and whenever that happens I have to stop and not move. And I hope that this will not be awkward for me this evening when I'm running around town with Benny.
So recently my dad has had to put these wires on his body to check his blood pressure and other stuff. And every time this thing starts making a noise, he has to stop and wait like a few seconds. And we just were walking around the city, and he had to stop a lot of the time, and it would be awkward because he wouldn't say stop, and then I would keep walking, and then I would look behind me and he would just be standing there.
Yeah, then we stopped at a cafe for dinner last night, and I was at the spot where they were giving me the food, and I had to stop, and I'm not allowed to move when he was doing it. And the girl was looking at me like, "What's wrong with you?" And I'm not supposed to talk either when he's checking my blood pressure. So some funny situations. I'm very glad to get this finally taken off. It's not the easiest thing to sleep in, but hopefully they'll find some information about me that'll help.
What are you watching, guys?
Oh.
Been watch Elf.
Good. Say E. Go down one more. Yeah, just be normal. Yes, just like this. You will feel better.
That's going deep. Oh.
5 minutes. You can be normal. 5 minutes you will stay like this. Yes. Just be normal. Okay, we can see the result of your blood test, and here is a plan of treatment. So I'm going to explain. We can see that leukocytosis is here. The number of leukocytes is increased. That shows that you have, right now you have an inflammation caused by bacteria. Another thing shows about this is phagocytosis. It's 3 times more active as it's supposed to be.
3 times more active than it should be.
Yes. So this medicine, first one, Immunofan, will fight with this together with antibiotics we already gave you.
Okay.
Okay. Another thing is циркулирующие иммунные комплексы. Grigori, help.
Circulating immune complex.
Okay, it's increased, and why it's bad? It's when it stays inside blood vessels or joints. Okay.
Joints.
And thyroid, it gives side effects. It causes autoimmune process.
Okay.
And to fight with that, to prevent arterial hypertension, hypertension, atherosclerosis, even obesity, we use this another medicine.
Okay, so if I take enough of this medicine, I won't have a belly anymore.
If you don't have, your belly will grow. But if you don't have, you have, it won't grow. And if you have and do exercise, it will reduce.
Oh, so I still need to exercise.
Yes, little bit.
That's too bad. Now we're going to show what we've never shown before, and it's the targeted injections with some kind of cocktail of medicine based on Benny's test results. And where are we going to put the first one? Dr. Luba.
In the back. Yeah, inside.
And what's it for?
It's for his brain.
Okay. All right. Well,
this one is for his brain.
All right. Let's go.
Okay.
And I think it's fair to say that it's not comfortable, but it looks a lot worse than it actually is. So I think a lot of people are like asking about these shots. They want to hear about them. It doesn't actually really hurt. I'm going to do it myself now. I'll make a terrible face when they do it to me. But it's just unusual to allow someone to put a needle into the back of your neck, the side or the front.
And we use very small needle, like less than 1 centimeter.
No, that's about
Small and six.
Yeah.
Thin.
All right, you ready, Ben? Hold still.
Wait.
Say me when you're ready.
I'll tell you.
Done?
Is it clean?
Of course.
Okay.
Starting.
Ready.
Done. And you can see that it is less than needle size inside. I push it slow. And Daniel is very brave boy. So you cannot see any changes. Its size of medicine is small. Down.
So this is actually it might not look like a lot, but this is actually the clinic's patented technology based on decades of research, and it's putting exactly what Benny needs, what I need, exactly where it needs to go. So I'm now about to get the shots. I'm a huge baby when it comes to shots. And again, it's like no pain, but I still am getting used to letting Dr. Luba stick needles into my neck. But the one in the back, so because of these different things they found, I do have a little bit of like intracranial pressure, so a little bit of hypertension. And this is sending some kind of medicine. And I will say, like, my head, before I came, for some months actually, it like I would wake up and there'd be pressure all over, and now it's clear. So something's working. I just have to let Luba do the shots, and the medicine does the rest, I guess.
Ready.
I was born ready. Yeah, I mean it's like just the tiniest little poke, but that's it. I'm glad they're using the smallest needles available.
This treatment is very important for your sleep apnea because for you this is most dangerous problem now.
Mm-hmm.
No, when he has less oxygen in his body, if he doesn't sleep, it's okay. But if he sleeps and during that time not breathing, that time his heart has less oxygen, and this can cause many bad things in heart itself.
Yeah, when I came, my blood pressure was like 130/80 something, which is, I guess, a little bit high. It's I guess it's not dangerous, but it's a little bit high for my age. Yesterday they took it and it was 100/60. Yeah, and what was interesting is they took it right after Benny and I arrived, so we'd been walking very quickly for like 20 minutes. And immediately after that they took it and it was 100/60. I have some other friends who came who have had high blood pressure for many years, and in the first few days they saw their blood pressure go down like almost immediately.
So even beard is not a problem.
That's good.
Yeah, it's done. Done. You couldn't feel it today.
Yeah, it's almost no feeling at all, but just I still am not used to this.
And throat, we're going to do today too.
Yeah, and soon we'll do the front of my neck. And that's so also interesting that I had thought I'd had lung problems. And so one of the things I learned is I actually don't have lung problems. I have great lung capacity. Everything's great about my lungs. But what's happening is because of what's happening in my nose and my throat, it's getting up into, I guess, what do you call it, my bronchial tubes? And that's the problem. So I'm actually really happy to know that I don't have some of the problems that I thought I had. Of course, I've learned about some other things, but the one in the front of the neck is for the bronchial, right? Yeah.
Right.
That's it. I think it maybe doesn't look like a lot, but it works, and it's this targeted treatment idea. Rather than the doctor just kind of guessing, oh, you have the symptom, take one pill for your whole body. So I'm already feeling different. I'm breathing. I'll say I feel more space in my head, or my nasal area, than I felt probably in my life. I didn't know there was that much space up there. I'm breathing through my nose comfortably for the first time that I remember ever in my life. I think probably there's some more improvement that could be done. So that's why there's still this treatment that I'm taking home. And I know that the first couple nights we were here, Benny said I was snoring really bad, and it's gone down throughout the week. So hopefully that trend will continue moving forward. So thank you, Dr. Luba.
Thank you. 9/11. So every alternative day, 7, 9, 11.
So the situation is we've been getting these targeted injections for 10 days now. But that's not the end. They're sending us with a whole prescription and treatment plan to go home. So Benny is getting his whole plan from Dr. Luba right now. Okay, so I have some friends and they use the CPAP machine. At night they're putting it.
I know.
So what do you think about this?
Oh, CPAP machine. What do you know? If you sleep, with helping with CPAP machine, special compressor, because it's a very noisy compressor, special mask in your face, in your nasal cavity, and a lot of different tubes. And as usually, the wife stopped to sleep with you, as usually, because it's not pathogenic way, it's artificial way to sleep with compressor and with mask, like pilot in aircraft.
Right.
Snoring is a reason of aging. of the body. No.
Usually it's because of infection, inflammation.
Yes, the reason of the inflammation are different infections, bacterial infections, viruses infections, and fungus infections. Maybe.
So if the snoring was caused by inflammation, then it can be treated.
Yes,
Okay.
snoring is a sickness and it must be treated. Absolutely. There are some serious consequences if the snoring wouldn't treat. For example, it would be irregular rhythm of the heart, blood pressure, and high intracranial pressure, and it is deficit of oxygen for your brain, maybe for every organs of your body, and maybe asystole.
Sorry?
Asystole, when the heart couldn't beat, when the heart couldn't rhythm, regular rhythm. I had one person who had asystole for 4 seconds.
His heart wasn't beating.
Yeah. It was very dangerous for his life. And obstructive sleep apnea syndrome, everybody has obstructive sleep apnea. And as for you, we can test of your obstructive sleep apnea. You have 19 apnea
Episodes.
episodes from 10 to 32 seconds for one night.
So I stopped breathing.
Yeah, you stop breathing. Absolutely. I haven't breathed. Absolutely. More than 30 seconds. And some episodes of hypopnea.
Okay.
Hypopnea. But danger is apnea. It's very dangerous for life.
Okay.
And you have this obstructive sleep syndrome.
Okay.
And you must treat snoring.
Yeah, so I'm 44 years old. I've spent the last 9 days in Perm at the Lymphotech Clinic. I found out way more about my body than I ever thought possible. I've spent more time with doctors in the last 9 days than the rest of my life combined many times over. I calculated I spent at least 6 hours talking to doctors about my personal history, looking through all these thorough diagnostics, understanding how everything affects each other. I came because of snoring. I found out that I have sleep apnea. I found out that it's affecting my blood pressure. I found out that it's creating hypertension in my head. And throughout this week, I'm already seeing changes. I'm sleeping better. I'm breathing for the first time in my life freely through my nose, which is unusual for me. And my blood pressure went down this week. They were checking it every day. So there's, I was given a comprehensive plan for going home, and so there's still more work to do. But I guess what I'm thinking a lot about this week is I didn't have some deathly illness. They didn't find some horrible thing wrong with me. I'm probably healthier than most people who go to the doctor. But if you're like me, if you're busy, you have kids, you have business, you're 44 years old, and you're starting to feel some differences in your life, in your body, it's worth going and doing this. Don't wait until you're on your deathbed to go to the doctor, because having good night's sleep is worth the money you put into it, even if it's just one night at a hotel. So think of many years of better sleep. Think of years without hypertension, years of having higher production at work. So that's something that I'm looking forward to. And I think this clinic, for just creating this concept where the doctors aren't in a hurry, but where they really want to go to the source of whatever the problem is and take care of it. So I also think it was great that I was able to come with Benny. We had, he was breathing through his mouth, but now he's breathing freely through his nose. And I think that will help him, going forward. So he's not growing up like I grew up, just breathing through my mouth all the time. So I'm excited about that for him. And we had a lot of fun together. You come to the clinic for just a few hours in the morning, and then we were able to go and try some of Perm's restaurants, walk to the mall, just have some ice cream, and we really had a great time over here. So if you're snoring like me, if you're feeling some differences, just send a message to the clinic. They'll talk to you and and come to Perm. It's a great city, great clinic, and your life will be changed after you come.
So when I came to Perm, I thought when we would come to this clinic that we would just have arm shots and get pills regularly, but we only had like one arm shot for blood, and then we had neck shots. And the difference between here and other clinics is that here they're more thorough, and they also they don't give as many pills. And I think Dr. Luba did great at explaining on what I have to do when I have to leave, what to do with the injections, and if they hurt too much, then with tablets. And I had an amazing burger for lunch.
Great hamburger. Okay, so that's the next part. So how much? Tell me about your regular day in Perm. What was your regular day in Perm like?
So my regular day in Perm, I wake up, I get my clothes on, then we go to Stalovaya, then we have sushi, hot dog, and 7-Up with a bit of Miranda inside.
For breakfast?
Yes. And then we go to the clinic, we have neck shots, we leave, we go to lunch. Lunch is usually KFC, SFC, and after that we come home, we either have pomini or we go out with someone.
What did you see in Perm that was like interesting?
I saw that there were green lines on the cement and asphalt for like tourists to like point them where to go. That's cool.
Okay. Did you where's the best milkshakes? What kind of milkshakes did you have while you're in Perm?
The best milkshakes are at a restaurant called Happy.
Okay. And then what other kind of milkshakes did you have while you're here?
I had some milkshakes at a place called Coffee Shop Company. They were fine.
What flavors?
Banana and bubble gum.
And then another place that's called McDonald's. What kind did you have there?
I had McFlurry.
McFlurries. Okay. And then what else did you see in Perm that you didn't know about?
I saw this clinic.
No. What about like walking around the city? Like you saw the river?
I didn't know that they had a huge river. That river was huge. It was long. It's pretty cool. And that's not even the biggest part of it.